Good afternoon, and welcome to today's virtual ceremony to celebrate the 2020 graduates of the Prisma Health Residency and Fellowship programs. My name is Dr. Kathy Stevens, and I am Prisma Health's Vice President for Graduate Medical Education. It's a position which brings with it the honor of serving also as the designated institutional official responsible for oversight of all of Prisma Health's medical, residency, and dental fellowship programs. Today's virtual ceremony is not what any of us had anticipated. The COVID-19 pandemic has disrupted all graduation ceremonies, and it has also disrupted our everyday lives. Our resident and fellow physicians have responsibilities in both the didactic and clinical areas. And over the past few months, all of the educational programs across our institutions have been affected. With these restrictions that were implemented to curtail the virus, we have all seen an impact. Despite the limitations, however, our graduates have worked diligently to meet their responsibilities. So from the bottom of our hearts here at Prisma Health, we thank each of you for your unfailing commitment to providing quality patient care to the patients here in our system during this challenging environment as you are completing your graduate medical education. We congratulate each of our graduates as you move on to your chapter, the next chapter in your life. For many of you, starting from kindergarten, this marks the first break in organized educational programs in a quarter of a century. Mind you, this is not the end of your education, though. If we've done our job well, we will have prepared you to now become independent learners who will continue to learn so that you can improve your knowledge and skills and also work with others to improve the healthcare system. All of this with the goal of improved patient outcomes and better patient experiences. We wish for each of you a successful and fulfilling career and trust that you will continue to provide patient care with the compassion you would want for your own families and yourselves. Congratulations on achieving this major milestone. I want to also recognize families and friends of our graduates today. Thank you for the sacrifices you have made in providing the essential support to our graduates in their journey toward independent practice. And I also want to send a warm welcome to members of Prisma Health's boards of trustees, the deans of the U of SC Schools of Medicine in Columbia and Greenville, and other special guests with us today. And finally, I would be remiss if I did not also mention another impact of the COVID-19 pandemic, and that is the inability to hold events to celebrate an historic milestone in graduate medical education at Prisma Health. That milestone is 100 years of graduate medical education in our system. A century is a long time, dating back to only a few years after the well-known Flexner Report on Medical Education in America. So today, let's also celebrate Dr. William Ferry, who was Prisma Health's first intern. Dr. Ferry completed an internal medicine internship in 1920 at the old Columbia Hospital, which was a predecessor of today's Prisma Health Richland. We thank Dr. Ferry and his teachers, long gone at this time, as well as subsequent and current residents, fellows, faculty, administrators, and GME team members for your roles in the education of physicians in training in the more than 50 residency and fellowship programs at Prisma Health. Thank you for joining us today in this virtual ceremony. We hope you will enjoy your time with us.
Good afternoon. I'm Mark O'Hala, President and CEO of Prisma Health, and on behalf of myself and the Board of Directors, I want to offer our heartfelt congratulations to all of you here at this exciting point in your careers. As you come to the close of your academic career and leave to venture into your own formal careers, there couldn't be a better time for you to be a physician in the communities that we serve. With the advent of the pandemic, which I'm sure none of you thought you were going to be worrying about when you finished your final academic careers, there is absolutely no better indication of why you're entering the careers that you have chosen. This is what we do. This is why we're here. And you are now going to embark on that challenge over the course of the rest of your lives in serving patients, serving your community, and taking the best care of the people that are your responsibility as you possibly can. One of the gratifying aspects of this graduation is the thought that nearly 25% of our graduating residents have decided to continue their careers with Prisma Health. We are so thrilled and so fortunate that so many of you have decided to stay here with us. We're pleased to have you. We welcome you, and we look forward to the rest of your careers with great interest and expectation. All of the effort, all of the dedication, all of the work, all of the long hours has been worth it. You've done a phenomenal job. Congratulations, and we wish you all the best of luck in your future endeavors.
Hello, my name is Dr. Tom Naska. I'm an internist nephrologist, and I have the privilege of leading the Accreditation Council for Graduate Medical Education. I'm honored to have the opportunity to speak with you on the occasion of your completion of this phase of your journey towards mastery in your chosen discipline. This is a major step towards your ultimate goal, the healing of the sick, enhancement of the health of your patients, and the opportunity to support the health and well-being of the community that you serve. I apologize for speaking with you remotely, as I would much rather be able to see the joy and pride in your eyes, as well as that of your spouses, significant persons, parents, children, brothers and sisters, and grandparents. I'm sure that I would also see the pride of your program director and faculty who have nurtured you on this journey to this day. Our collective pride is not only for your wondrous accomplishments over the past many years since you first contemplated becoming a physician, but also for the work that you, your faculty, your colleagues, and the nurses and other health professionals have done in stemming the impact of the COVID-19 pandemic on those you serve. My remarks will be brief, but I hope they convey the importance of this moment for all of us. I have 3 thoughts that I would like to share with you today: gratitude, concern, and optimism. And of course, at the end, a request. First, gratitude. You, your colleagues, the faculty and staff of your institution, and hundreds like it across the country, demonstrated the true meaning of altruism to the entire nation over the past 3 months. You demonstrated the quiet, persistent bravery of doing the right thing for the right reason, even when not in your own best interest. You took reasonable risks to your own health and well-being in order to save lives. But you went further. You demonstrated respect, compassion, empathy, and love for strangers in their time of need. You cared about them as well as for them, about people who were breathing their last breath, acting often as surrogate family members for those leaving life behind. This is truly heroism, and it has rippled through our society. Your demonstration not just of technical expertise, but caring humanity, this outward manifestation of altruism on your part, has resulted in the reinvigoration of the trust of the public for physicians, nurses, and other caregivers. This selfless demonstration of humanity in a most dire time has renewed the social contract between the profession and the society we serve. While New York and New Jersey were the epicenter of this outbreak, these behaviors were present across the entire nation, from Seattle to Miami, San Diego through Chicago and Detroit to Boston, in rural Nebraska to Albany, Georgia. Everywhere there was a need, you and other caregivers tried to fill that need. My second thought is concern. concern for your personal well-being as you move to another stage in your professional career, continuing to deal with this healthcare need that a population is in self-dealing with the pandemic. Each of us in our roles in healthcare have been touched by this pandemic. In a profession that had nearly 50% of its number feeling emotionally or intellectually challenged due to the workload and other pressures prior to the pandemic, the psychological impact of dealing with the workload and personal pain of coping with death of patients in large numbers due to a viral disease without effective treatment will be significant. In a recent article in the New England Journal of Medicine, Doctors Victor Zhao, Darryl Kirch, and I warned of a parallel pandemic, the silent epidemic of pain, burnout, depression, and post-traumatic stress that we fear will emerge in caregivers over the next few months. I ask you to watch for the signs of depression, burnout, suicidal ideations, and other symptoms in yourself and the members of your team. Be open about this challenge, support each other, be willing to ask colleagues how they're doing, and acknowledge that you may also be at risk too. You must trust that as you have been there for others, others will be there for you in your time of need. Please don't go it alone. Finally, I have tremendous optimism and a request. You are the generation who have tackled the coronavirus, have had the opportunity to change healthcare for the better. You have seen firsthand in the emergency room and the ICU the devastating impact of disparities in healthcare access, treatment, and the social determinants of health on serious illness and death in our population. The disparate death rate in Chicago for African American citizens, the outbreak in workers of Hispanic origin in meatpacking plants in the Midwest, or the horrific death rate among Native Americans on reservations in the Southwest must call us to action. It is time for physicians, nurses, and other healthcare professionals to show America how to treat each other. We have seen how public responds to our work on their behalf with respect and admiration. We must now more than ever use that respect and admiration towards the goal of reduction in disparities and achievement of equity and access to and outcomes of health and well-being. This is my request of you. As you move through your career, do not lose the passion you have demonstrated for helping others. Make it part of you, who you are. Aristotle would say that you are habituating the virtue. The altruism that brought you to medicine many years ago has bloomed into a gift for society, the gift of caring about someone while caring for them. Please find ways to do that for everyone in society, regardless of their status or ethnic background. If you are able to do this individually, collectively you will have produced the health, equity, and fairness that we all desire to see for those we love. And when you reach an age similar to mine, you will look back and be able to say with pride that you made the difference you aspired to make when you chose medicine as a career. Let altruism be your touchstone, your bridge over troubled water in times of uncertainty. If doing the right thing for the right reason, even when it's not in your own best interest, is your guide, you will make just decisions. I know that because you have already shown it to be true. Thank you for your commitment to excellence. Thank you for your altruistic commitment to those we serve, and Godspeed on your journey of service. Congratulations.
Hello, I'm Dr. Les Hall, and I want to add my welcome to the 2020 GME graduation ceremony. This is the 6th year I've had the privilege of congratulating our residents and fellows who are completing their training within our healthcare system. And this year, just like every previous year, I look at the quality of physicians and dentists that are completing our programs, and I must say I'm just incredibly proud to be able to call you my colleagues. But this year is different than previous years in many ways, as you know. The final few months of your training have been altered in a way that you'll never forget by the coronavirus pandemic. And as you look at the coming years, it's likely even as you begin your practice, you're going to, at least for the immediate future, be deeply affected by COVID-19. As I think about what it's like to start a medical career during an infectious disease outbreak, my mind goes back actually to my own residency training, which took place a long time ago. In the early 1980s, as an internal medicine resident at Bethesda Naval Hospital in Washington, D.C., I admitted a young serviceman who had been evacuated from Panama to our facility with a high fever, confusion, a strange skin eruption, and he ended up having cryptococcal meningitis with disseminated cryptococcosis. He was the first patient I ever saw with the acquired immune deficiency syndrome. At that time, there was a very bright Army physician who had just finished his infectious disease training just down the road at Walter Reed Army Medical Center. His name was Dr. Robert Redfield. You may have seen him on TV some in recent weeks because he now heads the Center for Disease Control. He talked to us a lot about AIDS during that period of time, and he predicted then that AIDS would end up changing many elements in our society, including how we relate to one another, how we organize healthcare, and even he predicted it would have impacts on the political landscape. At the same time, just across the street from Bethesda Naval Hospital at the National Institutes of Health, there was a very bright young immunologist named Dr. Anthony Fauci. And he would soon be named after that as the director of the National Institute for Allergy and Infectious Disease. And he would work over the next several years to define many of the characteristics of the HIV virus that became so important to understand as we tried to gain control over the AIDS epidemic. In those very early days of treating AIDS with no effective antiviral therapy, the prognosis for our patients was not good. And although we could treat opportunistic infections in the first several years of my career, including the time I was a resident, we lost many patients because of the AIDS infection. But as you know, over the last few decades, our treatment of HIV has become much more effective. We have doctors here who do remarkable work in treating HIV effectively, and we are in a very different place now, thanks to contributions from thousands of researchers and millions of healthcare workers who have worked together to bring about that improvement over time. A diagnosis of HIV is no longer a death sentence, and new progress continues to be made in how we treat that illness. So fast forward now to 2020. We're once again on the leading edge of an outbreak of viral infection that's very, very frightening. It's once again having profound impact on our entire society. And somewhat surreally, once again, Dr. Fauci and Dr. Redfield are on the front lines of these infections. They're on the evening news. Dr. Fauci is still leading the National Institute for Allergy and Infectious Disease, along with Dr. Redfield at the CDC. And I believe in coming years, the collective efforts that all of us put together will lead to meaningful progress in the prevention and treatment of this illness. And all of you will have some kind of role to play in that process. And I know that you will face those challenges very well. And sometime, years or decades from now, we will look back on this time and see how all of us coming together helped us to get through this and to produce a healthier future. In closing, I just want to thank you as our residents and fellows for what you've actually contributed to our healthcare system during your time with us. You have cared for more patients than you can count. You've taken more night calls than you wish to recall. You've helped to redesign care to improve our quality of care and our efficiency and delivery of that care. And you've challenged us, including me, with many great questions that have prompted us to go back and learn more and try to figure out better how we can improve the care that we're giving. As you move on to the next phase of your career, I look forward, and we all look forward, to following your great accomplishments in the years to come. So it's now my privilege to announce the Resident Teaching Awards that have been selected by our 3rd and 4th year medical students. Each year, our students are asked to vote on residents whose teaching has made a particularly significant contribution to their own medical training. The winners for this year's Resident of the Year are, from the class of 2020, Dr. Samuel Fleming from Emergency Medicine, and from the class of 2021, Dr. Zachary Webster from Internal Medicine. Our congratulations to both of these residents for their outstanding teaching. Thank you.
Hello, I'm Renee Connolly, Director of GME Educational Development in the Prisma Health Graduate Medical Education Office. And I have the pleasure of facilitating the Resident Ethics Series each year. This series was established to fulfill a resident-identified need for more practical knowledge of ethical dilemmas during training years. The case-based series is led by residents and fellows and includes professionals from across the campus at each conference, from risk management, legal, nursing, pharmacy, social work, chaplaincy, and attendings from each of the programs involved. The series has grown to include a surgical and medical cohort with 12 programs that are involved annually: dental, hospice and palliative medicine, general surgery, OBGYN, ophthalmology, orthopedic surgery, plastic surgery, family medicine, internal medicine, neurology, pediatrics, and psychiatry. In honor of the 10-year anniversary last year, the GME office established this Resident and Fellow Award for Outstanding Ethics in Practice. In the second year of this award, nominations were accepted from students, professional staff, medical staff, clinicians and providers, and residents and fellows from our programs. 6 of our nominees are completing their training this year, but the award is open to any resident or fellow in good standing. On behalf of the GME office and all our programs, I am pleased to present the 10 residents and fellows who were nominated and then announce the 2020 winner. I wish I had time to read the nominations for each individual, but rest assured that each embodies the honesty, integrity, and respectful treatment of others while encouraging and providing compassionate care to everyone. In alphabetical order, the nominees this year are Dr. Rachel Azevedo, PGY1 in Pediatrics, Dr. Jacob Hesse, Fellow in Surgery Critical Care, Dr. Nishanth Kodamori, PGY4 in Neurology, Dr. Jeffrey Meyers, PGY1 in Neurology, Dr. Alex Milgram, Fellow in Infectious Disease, Dr. Sheen Rivera, PGY3 in General Psychiatry, Dr. Matthew Rosner, Fellow in Endocrinology, Dr. Richard Smith, PGY3 in Internal Medicine, Dr. Ben Thompson, Fellow in Hospice and Palliative Medicine, Dr. Chris Zust, PGY3 in Neurology. Thank you all for the work you do every day and the ethical dilemmas you handle with fairness, grace, and patience. The winner this year of the 2020 Resident and Fellow Award for Outstanding Ethics in Practice is Dr. Ben Thompson, Hospice and Palliative Medicine. Congratulations, Dr. Thompson, and all nominees.
Good afternoon. My name is Cindy Otone, and I am the chair of Prisma Health Richland Memorial Hospital Board of Trustees. It is a pleasure for me to participate in our annual graduation honoring the Prisma Health University of South Carolina School of Medicine, Columbia's medical and dental resident graduates. First, let me extend my personal best wishes to each of you and to your families as you complete this extremely important milestone in your life. As the chair of Prisma Health Richland Memorial Hospital Board of Trustees, I have the distinct honor of presenting the 2020 Resident of the Year Award. This annual award is sponsored by the Prisma Health Richland Board of Trustees. It was first presented in 2002 and is now in its 19th year. The award is presented to one of almost 300 medical and dental resident physicians at Prisma Health in the Midlands. It recognizes outstanding achievement in humanism and in quality of patient care. It is meant to serve as a strong incentive to all resident physicians to develop and exhibit the traits that support Prisma Health and inspiring health, serving with compassion and being the difference. It is a substantial and a prestigious award that includes a plaque, a certificate, and an award of $2,500 net after taxes. The award selection process began this year, as it does in all years, with the residency program directors submitting the names of their nominees to the Graduate Medical Education Committee's Executive Committee. Following the review, the nominees were then submitted to the Prisma Health Richland Board of Trustees, who made the final selection. This year, there were a total of 8 nominees for 2020, and each will receive a certificate and a recognition award of $250. The nominees were Dr. William Gazzola from Surgery, Dr. Josiah Jackson from General Psychiatry, Dr. Katan Junjunwala from Neurology, Dr. Andrew Morrow from Family Medicine, Dr. Kate Parnell-Fisher from Obstetrics and Gynecology, Dr. Jodian Pinkney from Internal Medicine, Dr. Lauren Stout from Pediatrics, and Dr. Caitlin Tidwell from Emergency Medicine. Congratulations to each of you in being recognized as a nominee for the Resident Physician of the Year in your individual specialty areas. This is quite an honor. First, let me say that all of our nominees were excellent, and as we found in years past, this was a difficult decision for the board to make. This year, the Board of Trustees would like to present the Resident Physician of the Year Award to Dr. Caitlin Tidwell from Emergency Medicine. I want to share a few comments about Dr. Tidwell that were considerations in her selection for this year's award. Many patients who come into the emergency department lack access to consistent healthcare, stable shelter, and even food, making it challenging for them to make the lifestyle changes that support their long-term health. But despite these challenges, Dr. Tidwell makes time to ensure not only the immediate needs of each patient are addressed, but also that they are linked with services that help to inspire their health beyond just today. She serves with compassion and shows empathy for all patients. Prisma Health team members and patients describe her with comments such as, "She's a good listener. She's always calm. She's pleasant even when she's tired. She has a great bedside manner. She always does the right thing for her patients. I'm happy to have her care for one of my own family members. She's a resident with a heart of gold. Her patients appreciate her and her nurses love her. Dr. Tidwell makes a difference for all who are fortunate to interact with her, and we are proud to call her Prisma Health Midlands Resident Physician of the Year for 2020. Congratulations to Dr. Tidwell."
Each year, our resident and fellows physicians elect 4 of their colleagues to serve as officers of the Prisma Health Midlands Resident Council. These individuals go above and beyond in dedicating their time to these leadership roles. I want to recognize this year's officers who will be receiving a check and a plaque to mark their service. First, Dr. Michael Cryer, Cardiovascular Diseases Fellow, served as President. Dr. Matthew Gleaton, Family Medicine Resident, served as Vice President. Dr. Ajit Roy, Internal Medicine Resident, served as Secretary. And Dr. Corey Hamilton, Orthopedic Surgery Resident, served as Treasurer. Congratulations to each of you, and thank you for your leadership. I also want to recognize Ms. Lauren Hunter, wife of Emergency Medicine Resident Dr. Zach Hunter. Ms. Hunter served as chair of the Prisma Health Midlands Resident Auxiliary this year. Thank you, Lauren, for your time and commitment to the residents and fellows at Prisma Health Midlands.
I'm Dr. Chuck Carter. I'm the Associate DIO for Graduate Medical Education for our Prisma Health Midlands Residencies and Fellowships. It's my pleasure to recognize our residency and fellowship graduates today. From the Department of Dentistry, Jordan Braunstein, Diane Broom, Alexander Carroll, Nathan Ewalt, Sharon Housand, William Strauss. From the Department of Emergency Medicine, Jacob Baker, Lauren Fitzhugh, Samuel Fleming, Nicholas Graves, Aaron Hitson, John Montgomery, Robert Ratzik, Garrett Snyder, Patrick Spots, Brian Stogner, Amanda Stratton, Caitlin Tidwell, Jacob Wayland. From the Department of Emergency Medicine, Emergency Medical Services Fellowship, James Washburn. From the Department of Family Medicine, Meredith Ferguson, Kelly Garvin, Christian Jasper, Lindsay Junk, Michael Lovelace, Andrew Morrow, Alexander Roy, Megan Thomas, Ryan Walters, Christina Werner. From the Department of Family Medicine Global Health Fellowship, Audrey Gleaton, the Department of Family Medicine Preventive Medicine Residency, Blair Chance, the Department of Family Medicine Sports Medicine Fellowship, Jason Sharp, Alexander Wagner. From the Department of Internal Medicine, Harrison Cheeley, Catherine Compton, Catherine Fryer, Leslie Hilding, Susan Ivy, Matthew Mazzola, Tai Wen, Jody and Pinkney, Jesse Ray, Richard Smith, Mackenzie Sorrell, Haley Story, Terica Taylor. From the Department of Internal Medicine Intern Program, Hayward Mack, Josh Shane, Ross Taylor. Department of Internal Medicine Cardiology Fellowship Program, Michael Cryer, Namit Rohant. From the Department of Internal Medicine Endocrinology Fellowship, Heather Fischel, Omer Turar. The Department of Internal Medicine Geriatrics Fellowship, Michelle Kraus. The Department of Internal Medicine Hospice and Palliative Care Fellowship, Christy Ford Scales, Benjamin Thompson. Department of Internal Medicine Infectious Disease Fellowship, Alexander Milgram. Department of Internal Medicine Pulmonary and Critical Care, Sami Hanna, Simon Wagshur, Liang Zha. From the Department of Neurology, Ketan Junjawala, Nishant Kudamuri, Nino Kurashvili. From the Department of Obstetrics and Gynecology, Caitlin Fisher, Chandler Anabinat, Andrew Mather. From the Department of Ophthalmology, Wesley Garland, Jennifer Hartle, Peter Simone. From the Department of Orthopedic Surgery, Thomas Ergen, Adam Money. From the Department of Pediatrics, Neha Desai, Hillary Hosey, Elizabeth Huntley, Emily Kane, Catherine McMillan, Brittany Martin, Mark Murray, Andrew Reitinger, Lauren Stout, Debbie Walters. From the Department of Psychiatry, the Child and Adolescent Psychiatry Program, Shalika Gurram, Seth Lapek, Frank Peters, Michael Sigsworth. From the Forensic Psychiatry Fellowship, Aaron Dexter, Robert Ellis. From the General Psychiatry Residency, Austin Bopp, Joshua Jackson, Sarah Julian, Jason Kearns, Ben Go, Sheen Rivera, Carol Jane Robertson. From the Department of Surgery, Andrew Van Sickler. From the General Surgery Intern Program, Neelam Mulji, Jonathan Pennell. From the Surgical Critical Care Fellowship, Jacob Hesse. Let me add my congratulations and well wishes for your future practice to all our graduates. We hope that your practice life is fulfilling and that you are, if you're going elsewhere, that you'll consider returning to our community in the future. For those of you staying with us, we look forward to working with you on a very promising career. Thank you for all you've done for Prisma Health throughout your training, and congratulations.
Congratulations to all of our graduates. Some of you will begin your practice of medicine within the Prisma Health system. Some of you will do so in other locations. Others of you will continue your education in subspecialty fellowships. And some of you will also devote time to a combination of clinical care, research, and teaching in the academic world. Regardless of where you go next, for all of you, the world in which you will practice tomorrow is not the world of practice of our last generation of physicians. In fact, given the COVID-19 pandemic, it is not even the world of practice of last year's graduates. But you didn't choose to become physicians for the business end of healthcare. You chose this profession because you're compassionate men and women who truly want to care for people who need your knowledge and skills to maintain their health, to emerge from illness or injury, or to transition at the end of life. And that part of your job isn't changing. Patients and their families will always need your caring compassion. You've all heard the phrase that people don't care how much you know until they know how much you care. As you enter this new phase of your lives, keep that advice close to your hearts with the goal of being remembered by each of your patients as providing the care and compassion we would want for ourselves and our own families. Doing so will guide you to a fulfilling and successful career. Congratulations to each of you. This concludes today's virtual ceremony. Thank you all for coming.